just be alert that if you've got a child who's just not working to potential, then having a full functional, comprehensive functional vision exam is a really important part of finding out whether that's an issue for that particular child, because vision being a master sense and functional vision problems not being measured by sight, by other things, then you've got concerns about progress. We really do. That child deserves to find out and have their vision thoroughly assessed.
If you've ever stood in front of a classroom wondering why a bright student keeps losing their place, zoning out mid-sentence, or copying the wrong line from the board, it might not be their attention that's the issue. It might be their eyes working twice as hard as their classmates. Some students get labelled distracted or lazy when what's really happening is much simpler. Their eyes aren't tracking, focusing, or teaming the way they should. Today, I'm joined again by Paul Graham from Harmony Vision Care, someone who spends a lot of time helping parents and teachers understand why good intelligence doesn't always show up as good classroom performance. We're going to unpack how functional vision affects reading fluency, copying accuracy, and a student's ability to stay engaged. If you're a teacher, learning support officer, or anyone who works with kids who, quote unquote, should be doing better, this conversation's for you. But first, who am I? I'm Paul Salloway, founder of Optics Digital Marketing. We're an agency that helps independent eye care professionals to grow their clinics through effective digital marketing strategies. So, hi, Paul. Good to see you again.
Yeah, likewise, Paul. Good to see you again.
To begin with, how common are these focusing and teaming problems? How often do you see these types of patients in your clinic?
Look, I mean, we see a lot of kids in our clinic, so we're probably 70% of the population we see are teenagers or younger. So from 6 months old through to sort of teenagers, and so it's a very, very common part of the practice. That's why people find us, because they've kids have got some unexplained issues going on, and quite often we're the third or fourth person that's kind of seen them, because the kids are pass sight tests, no problem. They pass their screenings. They seem to be able to see in detail quite well, but then they're just not performing up to potential in classroom sort of situations. And so there's this question mark. And some parents have and even teachers have an intuition or a feel that maybe it is a vision thing, and so they keep going to sort of try and find something deeper. Others, it's parents are quite surprised to find out that it might be a vision problem, because they've got a teacher who's got some experience at seeing other kids have these problems, and they're referred in. And often parents will go, "I'm not quite sure why I'm here. The kid seems to be seeing fine." Well, then what's the concern? Oh, well, he's not reading well in the classroom, or he's making mistakes with copying, or we're seeing different parts of the day he's performing better in the morning than in the afternoon, those sorts of things.
So, what are the common types of classroom behaviors that might be misinterpreted as attention issues then, when really there's something else going on?
Yeah, or not being able to stay on task, becoming easily distracted. And I group them into what we call the performance symptom categories, where the task is visually uncomfortable to do, but the actual discomfort doesn't reach the conscious level of a sore eye or a headache or blur or anything like that. And it's almost like the person sort of retreats or backs out of doing that work because internally they're feeling uncomfortable. And then what happens in time for some of them is that they kind of associate any of that kind of work as being unpleasant, and so then they start to avoid. And so that's where the laziness comes through. It's this learnt response to kind of go, I don't like doing that, so I'm not going to. And I don't think it's a conscious decision. It's just the brain going, I'm not feeling comfortable with that, and so therefore I want to avoid it.
And so how can teachers tell the difference between a genuine inattention issue and a child who is just visually struggling?
That can be a tricky one. Some of the things they might look at is being able to pay attention very well on some things that maybe aren't so visually intense. versus when it comes to doing something like written work or reading. You'll get some kids where they've learned to read quite well and can have some minor vision problems and it doesn't get in the way. But when it comes to, say, writing, there's a marked difference. So a marked difference between reading and writing could be something that we see. And sometimes it can be really difficult to know because some of the symptoms that we see in functional vision problems are very similar to some of the things that you might have seen on the Connor scale, which is what they used to use to assess attention deficit. And so part of the procedure of finding out whether a child's got attention deficit is making sure that the vision's not, well, how much of vision might be contributing to some of those symptoms. And so that can be a tricky one to do. But if you've got variable performance across the day, or the child starts reading okay, but it's by the third page they start to falter. So like a fatigue component, so that could kind of be suggestive of a vision problem. So probably inconsistency across different domains, as opposed to being sort of distracted and inattentive the entire time.
So teachers, you think, should be on the lookout for certain patterns that might indicate that there are visual challenges happening, or is it realistically something that teachers, could potentially spot early on?
Yeah, look, it can be across time of day. If the child gets some other signs around more physical behaviours, so eye rubbing, sort of squinting, a lot of the time, the headaches that some kids get in the afternoon is blamed on not drinking enough water. That's a very common one. And so you kind of go, well, if you're getting headaches in the afternoon, just don't immediately think it's a dehydration issue. That could be a sign that it's a vision problem. So you've got those sort of things, that the physical signs of discomfort. Hopefully, that's one that you can kind of, if put it this way, if a child shows a physical sign of discomfort, I mean that ticks the box for you quite nicely. It's those ones where you kind of go, oh, why aren't they concentrating? They seem quite bright. One example might be that you talk to the child about a particular subject or topic and they just get it. But when it comes time to putting pen to paper, that's when they struggle. And that's part of those inconsistencies that we talk about.
Okay. Well, like most schools, I believe, have screening now, like eye screening. And I'm sure that, many educators have heard of 20/20 vision, but functional vision is a different concept, isn't it? So what does functional vision actually mean in the context of learning?
So it's how your vision functions, so how you've learnt to use your visual system. And if we like to think of the eyeballs are just these sensory instruments. They're bits of brain that you point at things. So there's a motor system involved. It is a unique fine motor system. So you need to learn how to move the eyes comfortably. We've also got two visual channels where your brain has to make sense create one visual world out of two separate visual channels. And again, that's something that is developed and learnt through time. And so it's more about that coordination of all of that input with everything else that you're doing. And in the basic scheme of things, if you're having to think to just point your eyes at things and keep them in focus, or have to think in order to shift your eyes accurately, then that's going to borrow concentration away from the cognitive parts of what you're trying to do. So it's going to interfere with learning. So if unconsciously you're concentrating on getting the two eyes to work together, getting them to focus and getting them to move, then you've got a lot less concentration left over for learning new things.
And why don't children report these issues themselves? Why don't they, why don't they make their parents and teachers aware of them?
Well, there's a good variety of reasons for that one. One that we sometimes get is kids just thinking let's take what I consider one of the more extreme symptoms is double vision. People talk about double vision a lot, but I don't think it happens as frequently as what they say. But I remember seeing a boy just last week who, I'm like, how long have you been seeing two of things? He said, oh, it's always been that way for as long as he could remember. And I'm sure prior to school it wasn't there, but it kind of just crept up and it became just normal. For him, because he doesn't, it's not talked about, and so he doesn't hear it. And I think that part of that story is that these functional vision problems can kind of creep up and be cumulative over time. And so, the kid who gets sore eyes or headaches,
Mm.
It's probably the fortunate one because it kind of is a bit of a red flag early on.
Mm.
Whereas the
Mm.
ones who kind of get that creeping discomfort and just learn to kind of avoid and back out of it can be a challenging one. And everyone talks about vision, and when they use the word vision, they just mean sight. So I think we're all conditioned to think that clarity is the only thing. So it's not just part of our sort of the way we talk about vision.
So it sounds a little bit like the old boiled frog scenario, where
Yeah,
if problems happen gradually over time, then you just adapt to them. So maybe a
exactly.
little maybe a little bit like cataracts with older people, so they might not really under or realize that their vision is slipping over time.
Yeah, and we see that myopia too. Myopia creeps up on kids, and if everything's sort of based around sort of near work, then you don't notice the distance vision going. But yeah, I think the ball of frog's a great example of these things kind of
Mm.
creeping up over time. And we've had a history of doing school screenings, and you might get some kids where our school screenings we were trying to pick up functional vision problems, so convergence, focusing, eye teaming, not just whether they can see clearly. And sometimes at maybe grade one level, the demand of the work and the size of the print is
Mm.
not too much that you can kind of have some chinks in the armor of how your functional vision works and it's not affecting you too much. And then all of a sudden, grade three hits and they're in there and they've got a problem. It's because there's this jump in the volume of text that they're having to read.
Mm.
And then the
Mm.
size of the print gets smaller. And now we're shifting to the way we like to used to talk about it is, prep to grade two is learning how to read.
Mm.
And then grade three, four, five, etc. is now you use reading for your learning. So the
Mm.
cognitive demand really increases. So there's a lot more pressure on accuracy and all of those sorts of things.
Mm.
And so it can be one of those things where it seems to come out of the blue, but it's kind of been building up, and it just takes
Yeah.
a sudden increase in the demand to
Yeah.
tip them over the edge.
This makes me think of something that I've been hearing a lot about recently, like online, and I even know people in my network who tell me about this, where kids might be doing okay in primary school. When they get to junior, they really struggle, like even to the point of like refusing to go to school. It seems like there is a real leap in like the demand that's placed on them, and I'm wondering if some of that can be tied back to like the visual demands on their system that they've just not able to cope with.
Yeah, and look, you might find that there's a certain area from school to school. There might be a certain grade level where doing a lot more tablet use or a lot more laptop use, kind of like grade four, bang, we're all going to start using laptops.
Mm.
And that might sort of be one of the things that suddenly increases the demand. I think there's that developmental, sorry, the change in the size of the print doesn't necessarily go in a developmental way. I think that's a strong shift where you move into chapter books and suddenly it's pages and pages and small print and there's less pictures to help you kind of work out what's going on. And so you're really having to lean into
Yep.
that decoding and
Mm.
extracting information from the text itself.
Yep. And you're just required to do a lot more reading as you progress through your academic life, aren't you? So
Absolutely.
it becomes almost a stamina issue.
Yeah, exactly. Yeah.
Mm. Okay, so what are some of the other academic signs maybe that a student's potential is being blocked by vision related issues? Like, is there like do you often see like a disconnect between a child's verbal skills versus their written and reading skills? Is that one?
Yeah, and that's what we were talking about earlier with maybe a teacher being able to spot the fact that the
Yeah.
kids have the capacity to understand a subject, but then when it comes to doing an assignment, doing some written work, doing an exam, there's a difference there. So when you're having to do that kind of prolonged work, having to copy off the board, or you enlarge the print and the reading seems to get easier,
Mm.
then that's sort of an indication that maybe vision's involved. So, but if you have a look at a population of kids who might be struggling with literacy, now whether it's diagnosed as specifically as something like dyslexia or whether it's just they're not reaching particular standards, then there's a body of research that sort of indicates there's a lot more sort of functional vision problems in that group. And
Mm.
so we're not going to get into the debate of whether it's causative or not. I think we just say, look, it's associated. The two things occur together. And we don't want to make a sort of a strong link between the two. But the very fact that the kids who are struggling academically are also the population of kids that have a high proportion of these functional vision problems, means that, well, you've got two flags there. You kind of go, well, one may predict the other. And so if a child's struggling academically, then there's a chance that they're also struggling visually from a functional point of view. And so that should be a flag to kind of rule vision out as a problem. And if we get a child in where they're struggling with reading, we find a vision problem, we treat the vision problem, and their reading takes off. It was never a reading problem. It was a vision problem. Okay. Now, not all cases like that. That would be awesome if it was as simple as that. But if you get a child where they've got a reading issue, we find a vision issue and we treat the vision issue, but they're still struggling academically, then we know we've got a few things going on. You've ruled out vision being the cause, but now you've also got a child whose vision is now supporting their recovery, remediation, catching up sort of process. So that's where I see vision being an important part, even if it's not the cause of the academic issue, is you don't want that to be yet another thing that the child's having to deal with.
So I have a lot of empathy here for educators in the sense that, like, if they've got a child or one of several children that they're responsible for, and that child is experiencing some problems in the classroom, it could be a vision issue, it could be, something else like ADHD or dyslexia, it could be just, like their home environment. There's a lot of potential things that it could be, but it sounds like what you're saying is one of the solutions here is process of elimination and actually like ruling out whether it's the visual system that's at fault here.
Yeah, and I think we've talked about this on previous interviews that 70% of the school day is engaged in environments that are highly visually demanding, and so that's the modern classroom and modern life now. And because we look at sort of vision as being the master sense, that it's kind of it puts a lot of influence on how we understand the world and how we learn and how we interact, that sometimes for some people it only takes a mild vision problem to kind of really cause some interference and some problems. So it's an important part to at least eliminate the whole process. And the way I also look at it is, if you do need to move on and get sort of educational assessments done, so if your child needs more cognitive assessments, educational assessments, and they go into those assessments with a functional vision problem, they're very demanding tests to do. You want to make sure that that's not going to influence the outcomes. And unfortunately, we don't have sort of any research to sort of show, does a functional vision problem impact on those cognitive assessments? It would make sense that you just want to make sure that it doesn't.
So I think you're saying that it could lead to some false positives when it comes to these
that would be my concern. If someone's not aware of taking, and I know they are often careful in those processes to piece it out and take breaks and those sorts of things, which would satisfy some people if they've got a vision problem, that taking a break is an important part. But in a lot of situations like the classroom, they don't get to take breaks. It's particularly if their break needs to be after every 10 minutes. You're not going to get through your work very easily doing that.
Okay, well, if you're a parent or educator who's getting value from this discussion so far, then please do us a big favor and hit the like button. It only takes a second, and it really helps us out with the YouTube algorithm and increases the chances that someone else might benefit from this video as well. Okay, so Paul, what types of vision assessments should teachers know that an optometrist like yourself can perform? So, what are some of the things, like some of the diagnostic things you can do in your clinic that they should know about?
Yeah, so if we categorize it into the kind of tests of how you use your eyes are probably some of the critical ones that need to be assessed. And so that's not just how far can you move your eyes in your sockets, but how well do you move your eyes in your sockets? How smooth are those eye movements? Are they jerky? Are you having to move your head in order to do the eye movement, or is it all happening sort of smoothly and you're not having to get your head and body involved? So people call that tracking. We call it ocular motor function. So you've got the quantitative aspects of can you reach the corners? We're looking at the qualitative parts of that as well. How smooth do you do it? There's accommodation, which is the sort of optometric term for focusing. And that's your ability to not only get things clear, but to be able to sustain that over a longer period of time and then be able to shift it backwards and forwards at the right kind of frequency to copy off the board or copy off something on the desk next to you. And then coupled with that, we've got what's your ability to maintain good binocular function. How well are the two eyes working together when you converge and diverge? And there's two elements of that. There's the actual performance, how quickly can you move your eyes in and out with accuracy, and there's also the ability to sustain it as well. So how long can you sort of keep your eyes focused on a screen, book, page, or whatever that you're looking at. And so the how you use your eyes is a really big part. And then the next phase is, if that's all working well, are you understanding what you're looking at? So we get into more perceptual or processing kind of skills, being able to have your brain flexibly understand how parts and wholes fit together, being able to look at a symbol or an image and be able to know how to communicate to your hand to recreate it. Okay, being able to plan and spatially understand where you are on the page. So kids who have poor spatial awareness, they don't know where to start on the page and they start halfway through. They're not really predicting how much room they need to be able to write. There's some signs of some spatial awareness issues.
Interesting. Okay. And so these assessments often lead to therapy in your clinic. So I think we've talked before about the types of therapies and trainings that you can suggest for children to address these things.
Yeah, so basically, if we have a look at, we've got a number of tools available to help someone be able to use their visual system much more efficiently. And so, we can use lenses and tints and prisms and things like that to help them do the how to use your eye part more comfortably. If we see a sign that someone hasn't developed the right level of skill in being able to track or keep their eyes working together or focus, and they're going to be enough to assist them in that process. And then we can move into vision therapy. So we're actually providing an environment for them to better develop those really important how to look visual skills.
Okay. All right. Well, so I'm guessing that you've worked with many schools and teachers over the years. So from your perspective, what does effective collaboration between teachers and optometrists actually look like in practice? Like what kind of communication and feedback would you hope to have with a child's teachers?
Yeah, so having teachers being alert to the impact of those hidden vision problems on some of the kids that they're teaching, and so encouraging parents to follow up on getting a comprehensive functional vision exam if there are concerns about progress, whether it be, and we're not just talking about the child necessarily who might be in the bottom third of the class as an example. It might be a bright child who kind of goes, they were doing fine last year, why has it changed this year? And that's a classic one. You kind of go, that's that grade 2 to grade 3. Grade 2 dropping off to grade 3, vision may be that might be a red flag for a vision problem. So it's being aware of those sorts of things. The creating an environment where kids are sitting front onto the board rather than side on. I mean, I think that's a really important part. And I know that's not always easy in the classroom because of group time and things like that. But if there's anything where they're paying attention to the teacher, they need to be sitting sort of front on. So that can be just a basic useful tool. When we assess kids, we send out questionnaires, and it's very useful for us when we have a teacher who fills in one of those questionnaires for us. So they often get to observe a lot more of those visual behaviours that might indicate a functional vision problem even more than the parents do. So being able to fill in questionnaires to help fill out the history for the kids that we're seeing can be very, very beneficial. And teachers have a strong sense of, obviously with their own history, dealing with kids when something seems off with a particular child where they're just not working up to their sort of potential. And then probably the next part of the process is we will always provide a report, and a big part of the report is how the glasses are intended to be used if a child needs glasses. And so, an important role for teachers is that reinforcement of the kids wearing glasses because kids are kids. They go out to lunch, they forget to put them back on. So, and in the afternoons when they're at their tiredest, so that can be a very important part of the day to be reinforcing and just policing the use of what we've prescribed to help the kids.
Right. And I guess you would encourage a lot of outdoor time for kids even while they're at school, right?
Absolutely. Green time, not screen time.
Love it. All right. Well, if there's one message then from this conversation that you'd like teachers to take away, what would it be?
Just be alert that if you've got a child who's just not working to potential, then having a full functional, comprehensive functional vision exam is a really important part of finding out whether that's an issue for that particular child, because vision being a master sense and functional vision problems not being measured by sight, by other things, then you've got concerns about progress. We really do. That child deserves to find out and have their vision thoroughly assessed.
All right, Paul. Well, so wonderful insights as per usual. How can teachers and parents get in touch with Harmony Vision Care on the Gold Coast if they want to learn more?
Okay, so we've got our website, harmonyvisioncare.com.au. We're on Facebook. If you want to call the practice, that's 0755205900. We have lots of resources. We've got sort of our knowledge base on there with lots of different articles. Some of those are targeted to educators. We're working on redeveloping some of those pieces for teachers specifically. So we'll have some resources on the site that they can go to. So there's some good places. And then there's a way of contacting us through contact the optometrist or through our email if they've got specific questions on a particular child or a particular situation that they just want to understand a bit better.
And of course, let's not forget you've got a whole YouTube channel now with quite an extensive archive of videos like this one. So if you found this video helpful, once again, don't forget, please hit the like button.
Please, that's great.
And you can even subscribe to the channel so you'll be notified of more conversations like this one. And don't forget to follow Harmony Vision Care on Facebook and Instagram for updates, clinic news, and community events. All right. Well, thanks for watching. And thanks again, Paul. Thanks for your time.
Thank you.
All right. Take care of your vision, everyone. See you next time. Bye for now.
Thank you.